PD ranked as the second most common neurological condition, just after Alzheimer's disease. Parkinson's disease is something many people start getting diagnosed with around their early to mid-60s. And interestingly, it doesn't affect everyone equally. Men are about 1.5 times more likely to develop Parkinson's compared to women. And if that wasn't enough, in India alone, cases are expected to rise by a shocking 168% by 2050, which honestly raises a simple question. What exactly is Parkinson's? And should you actually be worried about it? In the next few minutes, let's understand what Parkinson's really is, the early signs that most people miss, and what you can actually do about it. What is Parkinson? Parkinson's disease was first officially identified in 1817 by British doctor James Parkinson. And today, on his birthday, 11th April is observed as World Parkinson's Day every year. But what exactly is Parkinson's disease? Parkinson's is a progressive neurological condition which simply means it develops slowly and gets worse over time. It affects a specific part of the brain that controls movement. It occurs when the brain cells, neurons, in the substantia nigra region die or become damaged, reducing the production of dopamine, which is responsible for smooth, coordinated muscle movement. So as dopamine levels drop, movements become slower, stiffer, and sometimes shaky. And over time, even simple things like walking or talking can start becoming difficult. In fact, the number of people living with Parkinson's has doubled in the last 25 years, with over 8.5 million people affected worldwide. Signs and symptoms for Parkinson's. This is where most people miss it. Parkinson's doesn't appear suddenly. In fact, most PD symptoms begin as subtle signs, almost unnoticeable at first, and then gradually progress over time. In the early stage, it usually begins with motor symptoms, which affects your movements, such as tremor, slow movement, stiffness, trouble walking, or maintaining balance. There are also non-motor symptoms, which people often overlook. These include sleep disturbances, constant mood changes, experiencing cognitive issues, dementia, and sensory disturbance. In some cases, involuntary movements, dyskinesias, or muscle contractions can also develop, making everyday activities more challenging. What causes Parkinson's? Parkinson's is not caused by a single factor. There are multiple factors that can lead to it. Some of the primary reasons may include damage to dopamine-producing brain cells, which directly affects movement control. Genetic factors. Certain gene mutations like SNCA and LRRK2 can increase risk for PD. Environmental exposure. Long-term exposure to pesticides, toxins, or pollution has been linked to higher chances of developing Parkinson's. Age and gender. PD is more common after 60, with men having higher chances. Even repeated head injuries and long-term stress causes Parkinson's. Furthermore, in many cases, patients may also develop something called Lewy bodies. It is an abnormal protein that gets deposited in the brain and disrupts the normal functioning of the brain. Treatment and care for Parkinson's. Now coming to the most important part. Can Parkinson's be treated? The honest answer is there's no cure yet for Parkinson's disease, but that doesn't mean there's no hope. With the right treatment and support, people with Parkinson's can still live a full, active life. The most commonly used treatment to treat Parkinson is through medication. Doctors often prescribe a combination like levodopa and carbidopa, which helps increase dopamine levels in the brain and improves movement. In some cases, other medicines are also used to control tremors and involuntary movements. For people with more advanced symptoms, there are surgical options like deep brain stimulation, which help control tremors and can even reduce the dependency on medication. But here's something important that often gets overlooked. Treatment is not just about medicines. In fact, most doctors will tell you medication alone is not enough to cure Parkinson. What really makes a difference is what you do every single day. Simple things like regular physiotherapy, strength building exercises, and practicing balance and walking can go a long way. Even basic activities like stretching or light yoga help keep the body active and flexible. While Parkinson's may be a progressive disorder, with early awareness and the right care, it can be managed. The key is not ignoring the early signs. If you found this video helpful, don't forget to like, share, and subscribe to our channel so you never miss out on important health insights like this.